Good afternoon, everyone. Thank you for the organizing committee for the excellent meeting. And actually, it's a very enjoyable meeting. My case today has a title of When a Wrong Move Costs a Lot. My patient was a 60-year-old gentleman, hypertensive, chronic smoker. He had a missed anterior STEMI 2 years ago, and he was managed conservatively. Then, for 3 months prior to presentation, he started to complain of angina pectoris class 2 to 3. His echocardiogram showed impaired left ventricular function with ejection fraction of 30 to 35%, with akinetic thinned out apex, apical and med anterior wall, and apical and med anterior septum. And he had a recent CMR viability study showing scarred this part of the myocardium, as the patient was complaining of significant pain. Then the next step was to do coronary angiogram for him. This is what we have found: a large obtuse marginal branch with severe stenosis at its med segment. The LAD had subtotal occlusion. However, it was supplying a scarred myocardium, so this was out of our calculations, and we concluded that this obtuse marginal branch with subtotal occlusion at its med segment is mostly the artery responsible for the patient's symptoms. So we had a plan to put 2 overlapping stents from this segment up to the paraosteal segment of the left circumflex, spanning this large high lateral branch. We did pre-dilatation, and then this was the first long stent deployed in the obtuse marginal branch. Following that, this was the next proximal stent. And after deploying the second stent, we have noticed that this large high lateral OM showed pinching of the ostium. And unfortunately, at this stage, due to unexpected movement of the patient, we lost the system. And the wires, the guiding came out, disengaged, and we lost the wires. And we had to re-engage again and to reintroduce our wires. This was how the high lateral branch looked like. So we decided to introduce a balloon and dilate this branch. This was a 1.5 balloon used for dilatation of this branch, followed by a 2.5 balloon inflated at the ostium of this branch. However, after doing so, we have noticed that the proximal segment of the stent looks deformed. I don't know if it's clear or not, but there was deformation of the proximal part of the stent. We reviewed the previous angios, and we have noticed what happened, that on reintroduction of the wires, actually our wires went across the stent from side to side, and when we performed balloon inflation, actually the 1.5 and 2.5 balloon was inflated across the body of the stent, causing deformation of this part of the stent. It was obvious that it was a wrong move from our side, and we deformed the stent got deformed, and now we were left with a deformed proximal segment of the stent at a very high OM branch in a patient with impaired ventricle, and we had to think what should we do. We thought that it will be impossible to cross again in the right direction in the stent, so we thought to keep the wires in place, and we introduced 2 larger balloons in both branches. And we inflated these balloons at high pressure, crushing more the proximal deformed part of the stent. And then we performed kissing balloon inflation for both branches. Then we introduced a stent covering the disfigured and the deformed part of the proximal stent. And this how it looked like. After that, we used a larger balloon, 4.5, to make sure that the proximal part of the second deployed stent well opposed at this segment. Then we recrossed the wire. At this time, we were very cautious to make sure that we are inside the stent. Finally, we performed kissing balloon inflation. And we got final good angiographic results. The patient was stable and was discharged safely second day. We had some lessons learned. They are very simple lessons, but I think they are worth mentioning that in all bifurcational lesions, once we put a stent in the main vessel, the next step should be optimizing this stent, proper post-dilatation and doing POT prior to proceeding with any other maneuvers. And the second simple lesson that whenever you put a stent and you lose the wire, please make sure, after reintroduction of your wire, please make sure that you are in the correct position before proceeding with any other devices. Thank you.
Great, thank you very much. So there were